whereas mental health is vital to everyone's overall health and well-being, with all Americans experiencing times of difficulty and stress in their lives. And whereas there is a strong body of research supporting prevention as an effective way to reduce the burden of mental illnesses with specific tools that all Americans can use to better handle challenges and protect their health and well-being. And whereas understanding mental health isn't only about identifying symptoms, diagnosing conditions, and receiving treatment, but also about eliminating stigma by dispelling false ideas about mental health conditions as well. And whereas the community mental health system in San Luis Obispo County is made up of strong individuals, organizations, family members, advocates, and coalitions which seek to promote wellness and reduce stigma while increasing people's awareness of how mental health disorders affect children, families, and our society. And whereas thousands of individuals in San Luis Obispo County are living productive lives as a result of prevention, treatment, and recovering services. And whereas the local mental health and wellness community, the U.S. Substance Abuse and Mental Health Services Administration, the National Alliance on Mental Illness, and the County of San Luis Obispo Behavioral Health Department invite all residents to participate in and celebrate Mental Health Awareness Month and guide those in our community who need mental health care toward the promising path of wellness and recovery. Now, therefore, be it resolved and ordered that the Board of Supervisors of the County of San Luis Obispo, State of California, does hereby proclaim May 2026 as Mental Health Awareness Month and calls upon all residents to observe this month with appropriate programs, activities, and ceremonies supporting the pledge to be stigma-free. Thank you.
I want to just take a second. We're going to talk so much throughout this month about the needs for awareness and understanding of mental health and the things that bring people to our front doors. I want to take a moment just to recognize also this is a great month to think about and recognize the people who serve those coming through the front doors. Our staff, the staff of behavioral health systems across California have been impacted so much in these last couple of years through changes and initiatives and great opportunity, but they're a tired staff. They work very hard and they all come to the door for their careers. As we just celebrated a beautiful career, everyone comes through the door with compassion and a need to give. And I really would just want to thank all the staff who are involved, and many of our team that are here today work so hard for the people of our community. So I want to start by saying that and then turn it over to Dr. Christina Rajlal.
Good morning, Chair and members of the board. I'm Dr. Christina Rajlal, the Division Manager for Prevention and Outreach Division for the Behavioral Health Department. Thank you for the opportunity to be here today on behalf of the San Luis Obispo County Behavioral Health Department. As we recognize Mental Health Awareness Month this May, we are reminded that mental health is a foundational component of a thriving community here in San Luis Obispo County. Over the past year, our residents have continued to navigate complex challenges, and at the same time, we have seen remarkable resilience, adaptability, and a growing openness to conversations around mental health. Mental health touches every aspect of our community. It impacts our schools, our workforce, our public safety systems, and the overall well-being of our residents. As a county, we have a responsibility not only to provide services, but to lead in creating a culture where seeking help is normalized and supported. Mental Health Awareness Month provides an important platform to reinforce that message. It is okay to acknowledge when you are struggling, and it is okay to ask for help. This is especially critical for our children and our youth who look to the adults and the systems around us to understand what it means to prioritize our well-being. So I want to take a second and I want to thank our board for your continued leadership and your investment in behavioral health services. Your support enables us to expand access, strengthen partnerships, and meet the evolving needs of our community. As we move forward, we remain committed to building a system of care that is responsive, inclusive, and grounded in well-being for all of the residents of San Luis Obispo County. So a big thank you. And next, I'd like to introduce you to Brita Connolly, our Behavioral Health Prevention and Education Program Manager within the Prevention and Outreach Division of the Behavioral Health Department. She would like to let you know about all of the wonderful events occurring in the county throughout May.
Thank you.
Good morning. I want to invite you all, and the community to come together through events such as the Mental Health Month Celebration and Resource Fair on May 7th at the Downtown Slow Farmers Market, which will be hosted by County Behavioral Health, Aspire Counseling Services, Transitions Mental Health Association, and Balance Treatment Center. The next Out of the Darkness Campus Walk on May 16th, hosted by Cal Poly and the American Foundation for Suicide Prevention. And lastly, a community bike breakfast in partnership with County Behavioral Health and Public Health and Slow Rideshare on Tuesday, May 19th. These gatherings provide opportunities to connect residents with local resources, celebrate recovery, and reinforce the message that no one is alone. We also invite our community to participate in simple but meaningful ways, such as wearing lime green throughout the month to show support for mental health awareness and taking time to check in with one another. These small actions contribute to a larger culture of care and connection. And it wouldn't be the Prevention and Outreach Division without swag bags. So in these bags, there are also mindfulness and stress reduction tools that I have for everyone here that I'm going to share. Also are the flyers of all those events that I just mentioned. So if you didn't get all the details, they're here on the flyers. And it's going to help you to celebrate the month with us. And always remember, our message on here is be kind to your mind. Thank you.
Thank you. I'm going to open it up for public comment on this item. Are there any other members of the public that wish to speak? Okay, seeing none, I'm going to bring it back to the board. Supervisor Ortiz-Lake.
Yeah. Well, this is really outstanding. One, to look at your faces and to know all of the work that you do. I just want to echo your comments, Frank, is that, you've been through a lot and we know how important mental health is. It really came alive during COVID. It continues to show us that we have to be more mindful of our children, all the way to our seniors and everybody in between. And each of you have contributed so much in developing this department. I just want to thank you just from like last week at the community collaborative that we now have with both hospitals here in San Luis, also representing the hospitals of AG and in Templeton, talking about mental health and public safety and all the tools that are out there. And, from the radio programs to all the extra infrastructure you've put in, just hats off to you. And we'll help promote this and be mindful and also take care of ourselves. Thank you.
Hear, hear. Supervisor Pichon.
I just want to thank you. You do some of the toughest jobs in the county, and you see people sometimes at their worst, but you also see people at their best. So thank you for all you do.
Supervisor Moreno.
Yeah, you bring incredible care and compassion to some of the people who are at their most vulnerable, and just thank you. It is so important to not just their individual health, but the overall health of our community, and I really appreciate what you do.
Supervisor Gibson.
Thank you, Mr. Chairman. I'll add my thanks, especially to those who offer this care, provide this care. Over the last decade, an incredible amount has changed, but among the things that have changed is a lot of progress on reducing stigma, and I think that opens a gateway that I think a lot of folks are ready to take advantage of. So hats off to you all, and thanks for being here today.
I'll echo those comments and just say, yeah, people are struggling right now, but I feel like our behavioral health department is stepping up to that moment and really implementing our strategic plan and doing the things that we've talked about for years and making the progress that we need to see. So thank you so much for all of you and your hard work. I know that we have the A team in our behavioral health department.